Welcome to Preparing for Childbirth. My name is Melanie Watkins. I'm one of the nurses in the labor and delivery unit here at DCH, and I'm going to help you get through all this information you need for labor. What are the objectives of our class? We want to describe the signs of labor, discuss the stages of labor, give you the policies of our unit, discuss medications and anesthesia available for labor, describe the possible indications for a cesarean section, help you develop a birth plan, and describe measures to promote adjustment during the postpartum period. What is a term pregnancy? A lot of people know what their due date is, but actually a term pregnancy goes anywhere from 38 to 42 weeks. 40 weeks is your due date. The average weight gain for a pregnancy should be 25 to 35 pounds. The uterus increases enormously in size while you're pregnant, as you probably know. What does the average baby weigh? We know a lot of people have babies that are 5 or 6 pounds, and then we hear sometimes about 8 or 9 pounds. The average weight for a baby is 7.5 pounds. Signs of labor. How will you know when you're in labor? Braxton Hicks contractions are the body's warm-up for actual labor. They are contractions. Sometimes they can be uncomfortable, but they are not as strong or as uncomfortable as actual labor. You may experience a slight weight loss due to the fact that the baby is compressing on your stomach and because you have a decrease in appetite. The baby may be a little bit quieter than normal. Baby simply doesn't have room to move around as much as it has in the past because it's getting so big. You may experience nesting behavior. It's nice to go ahead and get everything ready for the baby, but you need to remember you want to conserve some of the energy for actual labor. You may experience increased vaginal discharge and the loss of a mucus plug. The mucus plug can look like old blood, which would be brown, or it may be sort of a clear color. When you need to worry is if it's bright red blood. How do you know you're really definitely in labor? Your cervix will efface and dilate. When you come to the hospital, we're going to want to know about your contractions. When did they start? How long did they last? That's from the beginning of the contraction to the end of the contraction. We're also going to ask you about how frequently do they occur. To time contractions, you time from the beginning of one to the beginning of the next. How intense are they? Are they mild? Are they moderate? Are they severe? You can tell this sometimes by feeling the top of your stomach where the baby's at. Mild contraction will sort of feel like if you press on your chin. A moderate contraction will feel like if you press on your nose. A severe contraction will feel like if you press on your forehead. So you can kind of feel your stomach and compare that. Contractions usually begin irregularly. They may not be, you may have some that are 20 minutes apart and then they may decrease and be 5 minutes apart, but if it's real labor, they will develop a pattern. And as I said, you can feel these contractions with fingers on the fundus, which is the top of the uterus, or by electronic fetal monitoring. When you come to the hospital, we will put monitors on you so that we can tell the baby's heart rate and when you're having contractions. When you come to the hospital, if you think you're in labor, if you think your water's broken, we'll put you in the triage room. This is a very small room. It's just a place to be evaluated. If you are in labor, we'll move you to a larger labor room. Usually you're in the triage room for a short term. We'll do external monitoring where we put the monitors on you to tell about fetal heart tones and contractions. We'll check your vital signs. You'll probably have a cervical exam, and we may use nitrazine paper if you think your water's broken. Nitrazine paper is sort of like litmus paper that you might have seen in science class in high school. If we touch it to the fluid and it turns a nice pretty blue color, that usually means that it's amniotic fluid. The external fetal monitor is a painless way to record fetal heart activity and uterine activity. The monitors are small plastic discs and they just strap onto your tummy with elastic belts. If you are in labor, we'll move you to a labor and delivery recovery room. If you've already been to pre-admission testing, your papers will be in. It'll just take a short time to complete the admission. You can have 3 people in the room if you deliver in a labor room. If you have a C-section, you'll only have 2 people, but you're allowed to have 3 people present while you deliver. You can have other visitors if you need also. We'll be asking you lots of admission questions, your due date, your allergies, are you going to breast or bottle feed, who your baby's doctor's going to be, are you planning on an epidural, and we need all this information for you so we can take the best care for you. The goal of labor is to become fully dilated, or 10 centimeters. Now, how long will this take? Well, every labor's different and every person's different. And even if it's your second or third baby, that may not mimic your first baby. The average labor for a first-time mom is around 14 hours, but can last much longer than that. Effacement and dilation are the things that we're looking for when you're in labor and delivery, and we'll do vaginal exams to determine this. Your cervix will thin, shorten, and flatten during late pregnancy and labor. We measure this in a percentage. When you start out, you're 0% effaced. When your cervix is completely thinned out, then you're 100%. We may express this in terms of thick or thin, but we are looking for that percentage. The cervix will open up as the baby's head presses down on it to allow the baby to pass out of the uterus. You go from closed to 10 centimeters. 10 centimeters is when you get to push. Station is the baby's position in relation to some little bones in the mother's pelvis. When we do a vaginal exam, we can feel those bones and we feel the baby's head and we determine where the baby's at. If the baby is above those spines, that's expressed in negative numbers. -3, then the baby moves down to -2, then -1. 0 is when the baby's at those spines, and then +2, +3, +3, then +1, +2, +3, and then the baby's out. And this shows that the baby's moving down. There are 4 stages of labor. Stage 1 is the onset of labor until 10 centimeters, so that's basically labor. It's divided into 4 phases: early or latent labor, 0 to 3 centimeters. Now this can go on for several days or just a few hours. It's not uncommon to walk around and be a fingertip dilated, or 1 centimeter or 2 centimeters or even 3 centimeters for several days. Active labor is considered when you get to 4 centimeters to 7 centimeters, and usually that 4 to 7 goes a little bit quicker than that 0 to 3. Transition is 8 centimeters to 10 centimeters. This is often the most intense part of labor, but it's usually the shortest also. You think about this with the acronym EAT, E-A-T. And EAT is what you do not do if you think you are in labor. Because if you do eat a big meal before you come to the hospital, we'll probably see it again. Nausea is very, very common during labor, and it's not uncommon for patients to throw up during labor. So we encourage you, if you think you're in labor, to just drink some clear liquids, maybe have some soup, nothing more heavier than that. Stage 4 of labor is from delivery of placenta through 1 hour of recovery. Now, once the afterbirth is out, we'll be taking your blood pressure every 15 minutes. We'll be doing fundal checks. This can be a little bit uncomfortable, but it's a very necessary part of your care. We'll be rubbing the top of your uterus and massaging it to make sure that it is firm and that you are not bleeding too much. We'll also be looking at your perineum, making sure that you're not swelling too much, and we'll also assess your bleeding. Baby may bond during this hour as long as the baby's temperature is okay and there are no problems. And this is a great time to start breastfeeding your baby and to bond with your baby. If the baby's temperature is too low or if there are problems, the baby may go straight on to the nursery at this point, but we will let you spend a few minutes with the baby regardless. Some signs of early labor: GI upset. It's not uncommon to have some nausea and vomiting and even some diarrhea. You may feel crampiness, a low backache. You may have bloody show. This just indicates that the cervix is dilating. The cervix has a lot of capillaries in it. When it starts to dilate, these capillaries may break a little bit and some blood may come out. Bloody show often looks like old blood or it's spotting. If you are bleeding heavily like you're having a period, or you have clots coming out, this is a reason to call your doctor and come straight to the hospital.